Are you turning 65, going into Medicare, and not certain what to do about your health plan? Hi, I'm Tommy at medicalinsurancetoday.com. It's going to be my longer form video for YouTube. I help seniors every day that are going into Medicare and soon to turn 65, and it is confusing for seniors out there to figure out what's the right health plan, what plan to choose, what type of plan to choose. And I'm here to tell you that up front that it's a much simpler process than most people believe. The Medicare market is a much simpler market than it is advertised as, and there is help to get you through the process and make sure that you end up on the right health plan that's designed specifically for you. So first thing is, when seniors turn 64, a year before they go into Medicare, you're going to start getting tons of mail in your mailbox from all these different insurance companies advertising with all kinds of different letters and acronyms and explanations of what they offer and what they can do for you. And I'm here to tell you that 9 out of 10 people that I talk to are extremely confused about what it would be the right plan for them and which way to go. Other than identifying to a brand name company, that is about all that they can choose or have knowledge in what to do. So don't feel alone. Everybody's confused about Medicare when they're going into it, and people that are already on Medicare don't really understand what they have. So that's the first obstacle to cross, is that most people don't understand it, and that's okay. That's where an agent like myself can come in. I pride myself on doing an honest job by my consumers. All the insurance companies pay us the same. So when we offer you plans, it's because we know that the plans work and the plans do what they're supposed to do. And ultimately, we let the consumer end up choosing based on our conversations what they end up going with. So it's a no pressure kind of situation to use an agent because it doesn't cost you anything. And when you talk with us, we're here to help you, and we hope to help you ongoing into the future. So if you have questions, things aren't working, that we can help you untangle those questions. And as well, if you need to change plans every year, you have the open enrollment that comes in October, November, October 15th to December 7th to be precise, that you can change plans for the next year. So we want to help you in that capacity. Regarding Medicare, Medicare is the best insurance that you've ever had. So if you're going into Medicare and watching this video saying, okay, well, I don't know what to do, I'm going to listen to this guy. The reality is that Medicare is exceptional healthcare. It's better than any insurance you've ever had. Even if you had top tier insurance through your employer your whole life, Medicare is better. There's no arguing it, no question about it. And generally, it's less expensive. It's not always less expensive monthly, but in most cases, it will be. Now, when Medicare, taking that as premise one, that Medicare is really, really good quality, then it's figuring out, okay, what type of plan? Now, there's Medicare Advantage, and there's Medigap, and there's Part D, and there's all these different combinations of the way that you can approach it. Generally, most people in California, anyways, because this is a specific market, state to state. We work in California. California is going to have, especially in Southern California where we're at. We're in Costa Mesa. In Southern California, you're going to have Medicare Advantage, and you're going to have Medigap, and you're going to have Part D plans. So I really break it down into there's kind of two sides of a fence or two sides of a coin when I talk with my customers. You got Medicare Advantage, which is typically going to be the least expensive premiums out there. And I would say 75% of our consumers end up on Medicare Advantage. Whether they start in Medicare Advantage at 65, they're going to end up, generally 3 out of 4 people are going to end up on a Medicare Advantage type plan by the time that they get to 75 or 80. Medigap, the other side of the coin from Medicare Advantage, has a monthly premium. So that automatically detours a lot of people. They don't want to buy a Medigap because they can get it less expensive on a Medicare Advantage. And that's not a good or bad thing. Determining whether you fit into a Medicare Advantage or a Medigap type policy is really subjective. Everybody's case is individual. So I keep coming across people that I'm helping that have talked to a neighbor, they've talked to a family member, they're looking online, they're in a group chat, listening to other seniors tell them about what they should get, and it has no bearing on that person's individual and subjective needs for their health care. It is a specific conversation that takes 30 to 60 minutes. Generally, it takes about 45 minutes to get through a Medicare conversation to help someone figure out what the right plan is. And that generally gears around a couple things. What does your doctor want you on? What does your doctor accept? And will you be able to continue to see those doctors? What prescriptions do you take individually? Because that can be a real significant variable, because some plans cover certain drugs better than others. And that's where the knowledge of an agent can come in and help guide you, is talking about doctors and medications, that will kind of whittle down to a certain section of plans that you need to look at as a consumer to make sure that, again, that you're getting into the right plan. That's what this is all about, making sure that you get the care that you need at the lowest cost and the lowest monthly price. That's my goal. As an agent, is my goal. For consumers, I want to tongue-in-cheek it with you a little bit, that I talk to people coming to me all the time that have a preconceived notion about certain types of plans, and they're not informed properly. They're not right about what they've been told. And I see it on these online. I joined a recent online Medicare agents platform where seniors go and ask questions, and I was reading through it and I'm like, these people are giving bad information. And I've talked to a bunch of people recently that are like, well, I was on a chat and this person told me that I should look into this. I would advise to anybody that if you're still watching this video to go and find a reputable quality agent that doesn't charge any fees. It's not legal for them to, so they shouldn't be. That gives you an honest 5 to 10 minute conversation up front about what they do. That's how we operate. You know, it's an introduction. We talk about you, the consumer, and what your needs are, and making sure that we're addressing your doctors, your prescriptions, what you're interested in, what's important to you, and then that kind of points us to say, okay, well, here's the plans we should be looking at. And, you know, it could be all of them. You know, we can go through every plan with you if you need. Most people are really looking to just get into the right plan, and more importantly, they don't want to buy the wrong plan. I'm here to tell you, you should use an agent, because the agent is going to guide you through and be able to answer questions and talk you through, do the applications, help you manage the entire process, and it doesn't cost you anything. So why wouldn't you? I can't figure that out for the life of me. I've had some other people recently that told me, so I'm going to do this on my own. And that's fair. You know, you're entitled to do that. But why you wouldn't use professional expertise that doesn't cost you anything, like, is beyond me. So that's just word to the wise. You should find an agent if you're going into the market, because they'll be able to talk you through all these questions that will arise, that will come up, to make sure that you don't end up in the wrong plan. If you're choosing on your own, there's a good chance you're going to end up on the wrong plan. Medicare is much simpler than most people believe. There's Medicare Advantage and there's Medigap if you're in California, and the Part D drugs. And Medicare Advantage will generally include the drug coverage, the Part D, and with Medigap you have to pair a Part D plan together with it. Medicare Advantage is going to be less expensive. Medigap is going to cost you a premium and will cost more. And it, ultimately, to us as agents, it's up to you, the consumer, to tell us what you want. We don't decide for you, and we can't tell you what's right for you. You have to feel comfortable with your health care, and that's our goal, is to help you into the plan that suits you and is what you want, and make sure that, you know, it achieves your goals, is what I'll say. So if you're still watching this, please reach out to us. We would love to guide you if you're interested in Medicare or going into Medicare, or if you're already on Medicare and are not happy with your plan. Open enrollment's coming up in October. We would love to help you, and we'll be glad and proud to guide you through the process. So all of our contact information is below, medicalinsurancetoday.com, and we look forward to serving you.